Okay, what I heard were very hyperactive vowel sounds, which means you're probably hungry, um, which is normal in this case, right? Like the moment I placed the stethoscope, I heard vowel sounds right away. If they were absent, like the way I described earlier, the practitioner has to listen for 5 full minutes before they can rule out that there's absolutely no vowel sounds. Because no vowel sounds means the vowels, just like what I said, it's completely collapsed. Nothing's going on there. It's either blocked or there's some either mechanical or some nerve issue that's causing the whole thing not to work. Okay, so this peristalsis is kind of like the wriggly fluid-like motion. It's normal in this case. Hey there, JJ. Nice to meet you. My name is Hiraya. I've been asked to do an abdominal exam of you today. Is that something that you're okay with?
Yeah, of course.
Okay, so I'm just going to explain to you how the exam works. There's 4 components to it. The first part is just me taking a look at your torso and your abdomen, possibly your neck and face and arms and legs as well. So for that, I'm going to ask you to remove your shirt. Is that okay with you?
Yeah, of course.
Okay, and then the second part involves me listening with my stethoscope, and as well as tapping into your abdomen. That's called percussion. And lastly, lightly pressing down into your abdomen, and finally going to see if we can feel some of the organs, if that's possible.
Yeah, sure.
Okay, sounds good. Thank you so much.
No problem.
Alright, JJ, thank you so much for volunteering again for this abdominal assessment. So as I said before, the first part is inspection, which is just me having a look at your abdomen, your thorax, your face, neck, arms, and your legs. So as I'm doing this, I'm going to explain to you what exactly I'm looking for. In this case, I start out with the abdomen. Ideally, I want to be standing on the foot of the bed so that I could see the contour of the abdomen. Some people have a more rounded abdomen. Some people have an abdomen that sinks in. It's called scaphoid. And some people have a flat abdomen, which in this case is what you have. It's flat. I don't see any visible striations, stretch marks, or previous scars that may have been due to surgery. I also don't see any lesions, open wounds of some sort. I'm looking at the breathing and it seems regular. I don't see any pulsations. Sometimes we see that with aortic pulsations. Hair distribution is what we expect. I don't see any lumps, masses, bruises. Okay, so that's what I'm looking for. I also don't see any distension like what we would see in ascites when there's fluid in the abdomen collected, or when there is excess gas in the abdomen. Okay, moving up from the abdomen, I see that you have your fingers out here. If you could hold out your fingers like this. Okay, I'm just looking at your nails. I'm going to give them a squeeze here. I'm looking for your circulation, that they're well perfused, which in this case they are. I'm also looking at the shape of the nail to see if there's any clubbing. That's when your nails start to kind of change their shape into a more kind of like a concave shape that we see sometimes in obstructive pulmonary diseases. Also looking for any koilonychia, changes in nail colors, which would sometimes we'll see nutrient deficiency, iron deficiency. Could you do this, pull your hand up like that? There's no asterixis as well, indicative of liver problems. And if just look at the palm of the hand, I'm looking for palmar erythema, which in this case we don't see any. Perfect, thank you. From there, we're going to look at your eyes. Take a look at your eyes. I'm just going to sanitize my hand before I make contact. Okay, so just looking at your eyes, the sclera, which is the white portion, I'm looking to see if there's any jaundice or yellowing. We also see that with liver conditions. I'm just going to pull your eyelids down, okay? Alright, and the eyelids at the conjunctiva are pink and well perfused, so sometimes they're pale when there's anemia, as well as the lips. There's no cyanosis or bluish discoloration. Would you be able to open your mouth, say ah, and stick your tongue out as well? Okay, I'm looking at your tongue here. It's a little pale, and nonetheless, I don't see any lesions. You can close your mouth now. Also looking at the lips area, sometimes we'll see vesicles, such as in herpes simplex virus, any cracks along the lines, which is sometimes indicative of B12 deficiency. I'm looking for the aortic pulsations here in the suprasternal notch, which is visible. If you're able to turn your head towards me, okay, and then just relax your head. Okay, good, and that relaxes the sternocleidomastoid muscle. And now here we could see palpations here. So when we palpate, I'm just gonna press my hand onto this area here. Okay. Okay, so this is the jugular vein, because we don't feel it actually sinks in once you place your fingers there. Okay, so we can also measure the JVP. The height of the JVP will indicate liver pathologies. So for that we need 2 rulers. See if I can find my other one here. Alright, so I'm going to sit down here so we can have a better look. We can measure the jugular venous distension. It tends to climb up, as we see in liver pathologies. Okay, so what we do is, from the sternocleidomastoid, from the suprasternal notch, place a ruler, which in this case we use this one. This is a little too long, we'll just use this. And then we measure the height. Which in this case is 2 centimeters. From the pulsation. Okay, so it tends to climb up, as we see in liver pathologies. Okay. Alright, so moving down, let's see if I could shine a light to the neck area so we could better visualize the thyroid. So the thyroid gland is the butterfly-shaped organ that is responsible for regulating our metabolism by secreting thyroid hormones, T3, T4, T3 being the active one. Okay, you can actually see the pulsations there. Okay, so I don't see any masses like we would see in a goiter. Okay. Alright, so I'm just going to feel around your neck area here as well. If you just bring back your chin that way. Okay, so, and just relax. Okay, good. Okay. Yeah, you can actually feel, you want to feel your thyroid? If you place your hand, your right hand, where my on your left side here, you could actually feel, do you feel that kind of apple shape, like a very soft, and then what I'm doing is I'm pushing it actually so that you could feel it on the other side. You can see the difference when I push it and you can feel it versus without. So I'm actually pushing it towards your hand so you can feel it. So your thyroid is actually quite palpable here. And when we're feeling for the thyroid, I'm also feeling for any lumps, masses on the thyroid. Some cancers you can feel immediately just by that. We want to avoid palpating it at the same time, both sides, because that's going to could create an occlusion into our carotid artery, decreasing blood flow to the brain and cause fainting. So your thyroid's okay. While we're here, I'm also going to palpate for the lymph nodes. Do you mind sitting up? And then I'm going to palpate the thyroid. If you face towards that way, you can dangle your legs down. This is actually the better way to palpate the thyroid. So again, I'm going to repeat the thyroid assessment. So in this case, I'm just going to place my hand behind you, if that's okay. So again, I'm going to push it towards one side and feel the thyroid. Yeah, this is a lot better. And I'm looking for lumps, masses, or lesions, which in this case I don't see any. And then from here, we can also palpate the lymph nodes, which are these little round nodular balls that are responsible for our immune system. Okay, so for that, I'm going to start palpating from the back. So I'm just going to place my hand here. This is the occipital lymph nodes here. Alright, your submental, which would be under the chin, submandibular, anterior cervical, posterior cervical, and can you shrug your shoulders right here, infraclavicular, and then we also have them behind here, behind the elbows. And if you open your arms out a bit and just underneath the armpits here, and as well as the pectoral area or the chest area, which in this case we won't need to do. Okay, so I think that's it for the lymph nodes and the thyroid. We didn't find any kind of abnormalities there. Sometimes when we are sick, when we have a cold, the lymph nodes, especially around the throat area, you'll probably notice them to get they get inflamed. I don't know if you've ever noticed that, JJ.
No, I haven't.
Okay, like you have like some ball of, just like a swollen nodule. Never?
No, I don't really get sick that often.
That's good. You're healthy. Okay, so if you lay back down, that would be good. Alright, so we're working our way down. It's okay, there we go. Okay, so we taking a look at the lymph nodes, your eyes, mouth, throat, okay. Arms. Okay, before we move down to the abdomen, it's also good to kind of assess the leg area for the peripheral pulses, but also for edema. So I'm just going to remove these socks. Actually, yeah, okay. You're actually performing one of the tests right now, which is the obturator test, but by just rotating your so I was wondering whether I should save it for later. But in this case, we covered the obturator test. That's used to see if there's appendicitis. When we flex our hip and then externally rotate it, it can cause irritation to the appendix area. And if you feel pain by doing what you did, which is putting your legs in a figure 4, then that could be indicative of appendicitis. The other thing is this pressing against resistance. Are you able to lift this where my hand is? There we go. Any discomfort there?
No.
And the other one?
No.
Okay, good. So that one's negative. Okay, so good. We already knocked that out. And of course, I have to check the for pitting edema. Sometimes when you're seated for a long time, whether in a plane or whatever, your legs tend to swell up. That could show us some problems with circulation. I'm also going to feel for your pedal pulsus, dorsalis pedis, which is really good, bounding, nice. Posterior tibialis. Okay. Alright, good. And we checked your capillary refill, but I didn't get a chance to check your pulses, so I'll do that right now. I'm just going to place, if you're able to, I'm just going to place my hands here on your wrist area here. If you rest your hands on your abdomen, yeah, that would. Okay, we got a good, strong pounding pulse. They're regular in rate and rhythm. Perfect. Okay, good. So I think that concludes the inspection piece. So we took a look and we did some touching around, but for the most part, everything seems good in that respect. So now we're going to move to the second piece, which is listening with our stethoscope to the abdominal cavity. And although some doctors listen last for various reasons, I still like to listen first before percussion or palpation, because there was a time where I had a patient and this person was constipated, so they assumed this person was also elderly and was remained in bed for the most part, and because of that reason, it's assumed that the reason why she's constipated is because she's not moving around. And then what happened was for 2 weeks, a couple of weeks, she was being given a medication called milk of magnesia, which is magnesium hydroxide. It's kind of like an antacid. It's given if you have an acidic stomach to kind of reduce the acidity of the stomach acid, and sometimes it's given for people for a laxative to help them kind of have a bowel movement. And nobody has listened to the tummy, like nobody's listened for bowel sounds until I came in. This person had a distended abdomen because of presumably gas. Okay, so I took a listen, and what I heard was a sound that was quite distinct from other sounds that we would normally hear, like the gurgling that you would feel when you're hungry. So this is kind of like a very distinct borborygmus sound. It's kind of like listening into a hollow drum, and for the most part, the bowel sounds were they were not absent. They were there, but very the rhythm in which they, or the time in between you hear the bowel sounds are quite prolonged. So it almost sounds like they don't have it, and then when you hear it, you hear this kind of very distinct, loud, like hollow drum. So just by that, I wasn't quite sure what's happening. I just know that that's not a normal bowel sound. And so I notified whoever the physician was in charge, and when the physician also listened, also agreed with me that there's something not right. So we ended up sending this person to emergency, into acute care, so that they can have imaging done. And what they found was that this person actually has stage 4 cancer, and that cancer was obstructing the entire bowels. Like it was created a whole blockage. That's why this person couldn't use the bathroom, and that's why the abdomen is now distended. It's literally filled with fecal matter. So if we didn't catch it because of that, this person would end up probably start vomiting out feces, because there's no way for it to come out. And yeah, this person could just get poisoned by their own waste. So that's why I listen to bowel sounds first, because you can detect something quite significant before it progresses to something severe. The other very important reason is sometimes when we have an infection, especially in mononucleosis, okay, the spleen becomes so enlarged that the spleen is like this kind of like kidney bean shaped organ just right behind the stomach, usually probably around this size for you. When you have certain conditions like infections, this gets activated, which then, you know, activates the lymph nodes to produce more of the immune response, those immune cells, to fight off bacteria. So what happens when this spleen, just like how I said the lymph node enlarges during infection, the spleen can also enlarge to the point like past the umbilicus, the belly button. And so if we just poked around, we could actually perforate that spleen. We could cause it to basically, you know, it's like popping a balloon. And similar ideas with the aorta. When there's aortic stenosis or an obstruction of some sort, the aorta will kind of blow up like a balloon. And if you listen to the stethoscope, with the bell of the stethoscope, you can hear very turbid sound called bruise. So if we put listening after, you know, palpation, we could potentially rupture that aorta, which could cause internal bleeding and death. Yeah, it's very rare that that could happen, but that's the reason why I listen first. Now, some doctors don't agree with that for whatever reason. They want to do the percussion and palpation first, but you know, to each their own. Yeah, so just from my own experience, literature may say otherwise, but for me, that's what I do. So let's go ahead and have a listen. So I also will start listening from the diaphragm of the stethoscope first. There we go. We're gonna start listening. I like to kind of just warm this up so it's not introducing a very cold foreign substance. Okay. Also like to hold my stethoscope in such a way so that I'm not hearing my own pulse through my own fingers. Okay, so we're going to start at the right lower quadrant, which is where the ileocecal valve is, so you may feel something cold. Good. Okay. Okay, what I heard were very hyperactive vowel sounds, which means you're probably hungry, which is normal in this case, right? Like the moment I placed the stethoscope, I heard vowel sounds right away. If they were absent, like the way I described earlier, the practitioner has to listen for 5 full minutes before they can rule out that there's absolutely no vowel sounds. Because no vowel sounds means the bowels, just like what I said, it's completely collapsed. Nothing's going on there. It's either blocked or there's some either mechanical or some nerve issue that's causing the whole thing not to work. Okay, so this peristalsis is kind of like this kind of wriggly fluid-like motion. it's normal in this case. Okay, so do you have any questions about that?
No, not really.
Okay, good. Good. Yeah. What we can also do is shine a light onto the aorta here. In your case, because you have a very flat abdomen, you can actually see the aortic pulsation. I'm going to show where it is. Right about there, which is pretty cool. You don't often see it in most people. So, having said that, we're going to now listen for abdominal bruits. These are turbulent swooshing sounds that could be indicative of an obstruction in some of the arteries. Okay, let's look at the aortic artery. So this is the xiphoid. Okay. Good. Okay, I'm gonna go to the renal arteries. And a bit lower to the iliac arteries. Okay, I didn't hear any bruits there, which is a good thing. Okay, so I think this concludes the auscultation piece. We've listened and we didn't hear anything unusual. All right.